What is one of the worst exercises you could do for your thumb arthritis? I am talking about thumb CMC arthritis or basilar joint arthritis, basically arthritis at the base of the thumb. Well, the worst exercise is pinching. That could be pinching a ball or pinching putty or some other gadget you found online that promotes pinching to be the magic exercise that heals your thumb arthritis. Hi guys, I'm Michelle from Virtual Hand Care, and in this video I'll share the inside scoop about why pinching is one of the worst exercises for your thumb arthritis, and I'll show you a more effective exercise to do instead. Let's get right to it. Reason number one, pinching can increase your thumb pain and your thumb arthritis. Pain with pinching is often one of the first symptoms you get when you have thumb arthritis. In fact, depending on how you pinch, what it is that you're pinching, you could be loading your thumb up to 13 times more at the base of your thumb than what you're pinching at the tip of your thumb. In fact, one study showed that just a simple pinch compresses the tip of your thumb or the IP joint of your thumb about 3 kilograms, which is equal to 6.6 pounds. Your MP joint at about 5.4 kilograms, which is almost 12 pounds. But at the base of your thumb, just a simple pinch compresses your CMC joint at 12 kilograms, which is 26.5 pounds. Pinching involves repetitive and forceful movements of all your thumb joints. And because arthritis is known as the wear and tear of the cartilage between your metacarpal bone of your thumb and your trapezium bone of your wrist, this pinching can worsen your arthritis symptoms because you are repetitively loading the base of your thumb over and over and over again. And there could be little to no protective cartilage to take that force, and therefore lead to increased joint pain, more inflammation, and possibly more arthritis development. Reason number two, pinching encourages a loss of your palmar arch and your thumb web space. As your thumb arthritis worsens, you lose that ability to open your palm and your thumb out wide. And you lose this normal palmar arch space due to the shift that starts occurring at the base of your thumb. And just like I talked about in reason number one, as your cartilage starts wearing out at the base of your thumb, this can cause ligament laxity and muscle imbalances, and therefore a shift starts occurring and your thumb starts kind of pulling in towards that palm. And with less space in your hand to hold things, that greatly decreases your grip and your pinch strength. And if you keep repetitively pinching, thinking that's gonna help improve this palmar space or this thumb web space, I'm here to tell you that isn't gonna happen. The repetitive pinching will only continue to contribute to more loss of your arch and your web space unless you have learned to correct this first. Reason number three, pinching strengthens the wrong muscles. Don't get me wrong, pinching can be a great way to strengthen your thumb and fingers. However, the way you pinch is very important. The problem is when someone has thumb arthritis, the most typical patterns of pinching are with the tip of your thumb flat or pinching with too much flexion at the tip of your thumb. And this type of pinching over and over again will cause ligament laxity and therefore joint instability. And when that happens, you start recruiting compensatory muscles and tendons to get the job done. And what you are not doing is strengthening the key stabilizing muscles that actually can support and are proven to support your arthritic thumb joint. Plus, it completely depends on the type of pinches that you are doing. I bet you didn't even realize there are 3 different types of pinches, each one working your thumb a different way. Reason number 4 is pinching is more of an advanced exercise. It requires you to have good thumb and finger range of motion. It requires you to have good fine motor control and dexterity and proper strength and stability of your thumb and fingers in order to apply the precise amount of pressure that's required. But often there's no training on what's the appropriate resistance or load, or how to progress the pinch appropriately and safely. Bottom line is there are better alternative exercises and more effective exercises that do not put stress on your thumb joints, and I'll show you one shortly. And finally, my reason number 5, repetitive pinching focuses more on quantity over quality. Heck, most of the time, people don't even count or pay attention. You are likely doing 100, 200, 300 pinches when you're pinching putty or pinching a ball or some gadget. And these are typically of poor quality because you're not focusing on strengthening the right stabilizing muscles that surround your thumb joint. It's no different than pinching open a bag of chips 200 times. Ouch! Bottom line is to focus on proper form and technique rather than resistance and repetition. Now, don't get me wrong, I'm not saying you should not pinch when you have thumb arthritis. I'm saying using repetitive pinching to try to help your thumb arthritis pain is not the best approach. Okay, so now that I've proved my point that pinching is one of the worst exercises for thumb arthritis, what should you do instead? The answer is isometric ball grips. This is not squeezing repetitively or pinching a ball repetitively. This is much different and more effective. To do this exercise, you want to get a ball that fits in your palm, that contours that nice palmar arch and your thumb web space. So a tennis ball, a lacrosse ball, or a yoga therapy ball like I have here is usually the perfect size. And in fact, one article in the Journal of Hand Therapy supported the benefits of using a firm ball as a part of a thumb stability program. So to do this exercise, place the ball in the palm of your hand. Make sure the ball touches your palm completely and that there is no gaps between your palm and your ball. One way to check is to make sure you can't put a finger in between the ball and your palm. So go ahead and place your wrist down on a table. I prefer to do this exercise down on a table just because it can help support your wrist, support your hand, and really allow you to focus on your thumb. So already, before we even get started, you can see that the ball provides a stable position for your thumb CMC joint. Your MP joint and this IP joint are placed in slight flexion. There's not going to be any more strain to those ligaments or those joints with unsupported pinching. So to do this exercise, you want to press your thumb down into the ball, making sure you're maintaining all 3 joint positions. And then you want to go ahead and hold for several seconds. Now, this doesn't need to be a hard squeeze. You apply as much pressure as you can. And then you want to relax. And again, you want to apply some resistance down, some isometric resistance against the ball. Hold a couple of seconds. And what you should feel are these muscles, this meaty part of your thumb. You should feel that contracting. And then you would relax. And then you would want to start with just one set of 10 to 20 repetitions, and you can always work up to 2 to 3 sets. So as you can see, this exercise focuses more on the quality, using the correct muscles over quantity. You'll get far more results with 10 of these versus 1,000 putty pinches or ball pinches. And this isometric ball grip won't further contribute to your thumb arthritis. Now, keep in mind, this is not a magic thumb exercise. This exercise is not for everybody. It may not be for you if you already have more advanced thumb arthritis, or you already have a very noticeable loss of your palmar arch and you're not able to put the ball all the way in your palm. Now, with all that said, some people try everything, and sometimes surgery is needed. And there's nothing wrong with that. It can be very life-changing for people that are struggling with very severe thumb arthritis pain. But with that comes surgery cost, healing time, postoperative pain, incision care, swelling, and so on. So make sure you choose the path of treatment that works best for you. Now, if you liked this exercise and you want to try options other than surgery or injections, then consider joining my new thumb arthritis program. 30-Day Thumbs. Build joint stability, preserve joint health, and win back your favorite hobbies in 4 weeks. 30-Day Thumbs is a turnkey progressive exercise program created to stop thumb arthritis pain, prevent future flare-ups, and boost dynamic stability for optimal thumb use. Over a course of 4 weeks, I will coach you through a series of stretches and exercises designed to build healthy, sustainable thumbs while also teaching you lifestyle modifications for long-term pain relief. I have made it easy easy for you by laying out the exact exercises and stretches to perform each and every day, taking you only 5 to 10 minutes to complete. Plus, at the beginning of each week, I will host a live demonstration of the exercises to make sure you are doing them correctly and effectively. And as a bonus, you will receive my Thumbs Up Toolkit full of resources and guides and videos and educational tips to help you navigate all thumb-related products. Not to mention, you can complete the program anywhere and minimal equipment is required. But since no two thumbs are alike and you can't undo years of wear and tear, this program can be adapted to suit you, whether you need to take a little more time or make it a little less intense. Click on the link here or in the description box below to save your seat now. I'll see you there. Thanks for watching.